Yeah. Honorable Chief Minister, sir, Honorable Health Minister, sir, respected dignitaries and dear friends, I have to thank so many of you who have made this dream launch event possible. But before I do that, I take the liberty to explain what the launch of 10BedICU in Nagaland really means to all of us, and why we are so thankful and hopeful for this event. This event is a symbol of our collective belief that something as precious as access to critical care must be viewed as a right. Our belief in equal opportunity for critical care has a strong foundation and is rooted in the idea of justice. Professor Amartya Sen, the Nobel Prize-winning economist and a global expert on justice, has argued for making health equity central to the idea of social justice. Health equity means that everyone gets a shot at fair innings irrespective of whether they are in Noklak or Kohima, or whether they are in Dimapur or in Delhi. Our project questioned why it should be all right for people in remote districts or those who are poor or suffer from other forms of exclusion to have less than fair chances of recovery from COVID and other life-threatening diseases. Although this is just the beginning, we will continue to build on this promising start and make this project a truly transformational project for the state. Given the level of enthusiasm and overwhelming support we have received for the project from the state government, we are emboldened to dream that this project will go beyond being an island of excellence and trigger similar collaboration in other sectors and domain will be a start of something truly transformational for Nagaland. This launch has been truly a dream launch for all of us, and I have a long list of people to say thank you. First and foremost, I must thank the Honorable Chief Minister for believing in the project and for his gracious and limitless support for the initiative. Thank you, Honorable Health Minister, for believing in the project and setting the agenda and vision of the project. I want to thank Mr. Amardeep Bhatia, sir, the Principal Secretary, who is not here today though, for his support from the very start of the project till today. Thank you, Manicol John, sir, advisor to the Honorable Chief Minister, the invisible hand who played the role of a catalyst. Thank you so much, sir. Earlier, we planned to do a phase-wise rollout, but the Honorable Chief Minister expressed in December that we all should launch at one go all the 12 hospital TeleICU. Without your support, it is unimaginable how we could have completed the TeleICU setup for 6 locations in just a month. Special thanks to YK Sema, sir, the Health Secretary, for his energizing and inspiring presence in the field for tracking continuously each and every activity and continuously motivating our team. Thanks Asangla Imte ma'am for all the prompt order, frequent meetings and support. Thanks Joint Secretary Chubawati sir, Rena Bumo sir. Special thanks to all the committee members who ensure speedy approvals, whether it be internet connection, power supply or civil work. I would like to thank Dr. Kika, Joint Director. It has been an absolute honor working with you. Thanks for taking the ownership and championing the implementation. We were really inspired by your work ethics, passion and integrity. Thanks to all the track members for helping us with the launch event, Dr. John, Dr. Tinu, Dr. Asangla, Dr. Temsu and many others. I would also like to thank Ajit Ranjan, sir, DC Wakha, who had helped us during the initial tie-up stage. Thanks my friend Roland Lotha from the Rural Development Department, who helped me in establishing Connect during the MOU partnership. The success of the project lies with the ownership of the hub and spoke doctors. We're extremely fortunate and grateful to MS Dr. Sandimiran sir, Dr. Akhre for the ownership and drive. Without their support, the TeleICU hub and spoke setup wouldn't have been possible within a month. I also want to thank all the MS, medical superintendent, doctors and nurses in the district hospital for inspiring my team, for motivating my team. Thanks the donor, obviously, Mr. Khosla, thank you so much. Thanks HDFC Bank CSR team, who have been more than a donor, they have been like a team. Nusrat, Ritesh, Neeraj. Thanks Hamilton Medical for donating for every 2 ventilators we procured, they donated 1. Thanks Google Cloud for providing us the cloud credit. I also want to thank our vendors, Rajesh Sethi for LAN cabling, the team from BPL, our equipment vendor, Mukta Gohan and team from Hamilton Medical for ensuring the equipment were delivered, installed, TeleICU, LAN cabling and installation were done, irrespective whether it was a Sunday or Christmas or New Year holiday, everybody really worked hard. I want to thank the Unibro studio team members, Shane Jackson and Kevin for the beautiful CM launch video and all the amazing interview coverage you guys have done. Thanks to our field NGO partners, Venkat Garu, Karuna Trust, Dr. Avatosi of Nagaland Gandhi Ashram for supporting us with the field implementation and deployment. Thank you, Tialong from Gandhi Ashram for quietly and swiftly delivering results whenever needed. And obviously, thank you very much, the 10BedICU team, for all your efforts. Sei and James for becoming Superman, traveling across all the district hospitals to give user training. Atsi for being the enterprising and reliable state program manager in Nagaland, seamlessly coordinating with all stakeholders. Kajal and Chandraban for always surprising us and getting things that seem seemingly impossible. Whether the completion of ICU installation, TeleICU, Moita for all the crucial support for documentation, video making, Ashrumita for taking care of our guests and other support, Dipankar and Dibjyoti for playing this good supporting role. I would also want to thank Sujata, who has ensured all approvals and payments are done and smoothing the back-end operation, Perumalji for his support, Bala for helping us with the online event, Amruta, Gigi, Matthew, Aparna, thank you all so very much, and obviously Srikant sir for being the person it's so great to know him as a person, but a great leader and a great manager and an amazing human being. Thank you so much. Thank you very much. Yeah.
Thank you, ma'am.